Good afternoon and welcome back to the second teleconferencing session for our students of Diploma in Nursing Administration. We understand 2 students are there at Shillong. We haven't got the message from any of the other regional centers. Please do let us know how many students are attending teleconference. Well, we are continuing with your same block of the course 4. We will continue, sorry, not the course 4, yes, course 4 on the personnel management. And we are going to talk about the personnel policies now, because we thought this is interrelated topic, so get an idea what do we mean by personnel management and personnel policies. You've already seen Mrs. Shantama and Eliama Baby. They both are here with us from the St. Stephen Hospital and School of Nursing. I'm sure they'll be able to discuss more from the practical point of view the personnel policies which needs to be used, how they are made, how they are implemented, and what are the advantages, characteristics of personnel policies. So let us just go and define what is personnel policies. Mrs.
If you define personnel policy, we can say it is a guideline, guideline to act, or can say it is a predetermined course of action to achieve the organizational goal. Each institute is having the policies. Without a policy, we cannot able to work on that particular, we cannot able to maintain the discipline of that particular organization. So it is very important to have a policy. Each institute is having the personnel policies are there. Or you can say it is defined as a statement or understanding which provides a guideline for the employees. If I am working in a particular hospital, if the policies are there, if I know the policies of that particular hospital, it gives me a statement or understanding which provides the guideline for all the members what I can able to do, what are the restrictions which I cannot able to do it. So if we are coming to the characteristic of personnel policy, we can able to say that it is formulated which is based according to the objectives of that particular organization. So each organization is having the policies which is made according to the benefit or the goal that particular organization has to achieve. So it can be different. Different organization will have different policies. For example, the St. Stephen Hospital policy will be little different from other hospitals, because the St. Stephen Hospital goal is it to attain to whatever maybe the things is that particular organization goal is there. The policy is a kind of a declaration in writing. It is the declaration which is giving to the employee itself. These are the policies. These are written policies there. So we have to follow that particular. So it is we can able to say it is a kind of declaration which is given in writing. Another thing is that the policy conveys a definite decision resulting from a decision-making process. If the policy is there, we can able to take a decision very quickly. If the policies are not there, then we will say that can we able to do that? Can we able to give a punishment for that particular person who has misbehaved? Or if the policy is there, we can able to say that it is a written policy of that particular organization. So you have to obey that one and you have to do according to that. As you haven't done it, we can take the decision. Otherwise, it will take time. So if the policies are there, we can have a committee meeting and can say that it is written in the policy that this should not have been done. For example, if I am absent for a long time, that is the most thing which is seen in all service, for especially the 4th class people or the work who may be the thing. Even the staff nurses also, sometimes without any information they may be absent. They may have some reasons, but they are not informing. So if the policy is there, written policy is there, so that you are absent for this much time, so you are not able to join again. This means their service is finished here. So that is very easy for the administrator to say that. Otherwise they will say that why it is so, I can able to join because of this and this, I am giving a medical certificate from other places. Like that it can create problems. So if a written policy is there, it is very easy for to take a decision for the administrator. Policy acts as a guideline to the members. It gives a guideline. If I know the policy of this hospital, for example in our hospital, for taking an annual leave, we cannot able to take a break of 3 in a year. I can take a annual leave in 3 terms, but I cannot able to take more than that. So that is the policy which is made by, I know it. So it gives a guideline for me. I will not break like that. I will plan like that. Whenever I want annual leave, I plan like that because the policy of the hospital is like that. So I will not break that one. So it help me to it gives a guideline earlier for me. So policy is formulated by a definite committee. It is not easy. It is not only one person's thinking. It is made by the committee. The important senior persons will be sitting and making the committee people will be making the policy. Otherwise, some people employee can question like that also. What type of policy you are following? It is not genuine one. It is not the reasonable one. So the question can be done. So if the committee is there, the committee people go through this one several times and finally they will make the policy which is gaining, or can say, to attain the goal of the organization. The policy which is made by each organization, the main goal is to attain the goal of that particular organization. Policy is stable in nature, but sometimes, that means stable in nature means it is written policy, but it can be also flexible. Sometimes we have to be flexible also. We cannot able to adamant to that particular thing sometimes. We may have to. That's why in the case of the whatever may be the problems is coming, it may go into stepwise. For example, if I am a ward in charge, if I am able to solve it, I will solve it there. If I am not able to solve it, go to the DNS. If the ANS, if the ANS is not, it will go like that. Finally, if it is not able to solve it, it will go to the director also. That means
yes, Shillong. Yes, Shillong. Yes, Shillong.
Yeah, since we don't have any assignments or anything, I would like to know what kind of questions will be coming for December exam.
You see,
Or exam date.
see, you are if you are our second batch of students.
I am second batch student.
Second batch of students. That means you have joined this January.
Yeah.
So you will not have assignment, but the next year we are starting the assignments again. The question papers we will put it on the website. All the old question papers will be put on the website, or we will send at your regional center also. The regional center does not have a question paper. We will send a copy, or we will send a copy to the program study center.
Okay, ma. When it will be?
Well, you have told me today, by Monday we will try to post it.
Okay. Exams of December.
Yes. Normally our SRE division puts the question paper on the website.
Okay.
So you kindly search the website also of IGNOU, ignou.ac.in. Okay? And go to the page and check the question papers. In the meantime, I will send it to the regional director also, who can send to your program study center.
Okay.
Okay.
The exam date will be
It is somewhere middle of December.
middle of December.
Please check the website also. I don't know the exact date. Please check the website.
Thank you, ma'am. Okay, then. Thank you.
Okay. Okay. You have a lot of echo. The students are not able to listen clearly. So kindly control that echo. I am not able to listen also. Thank you so much. Yes, please.
so it is whenever the organization is making a policy, it should be clear and easy to understand for the members of that particular organization. If I am making a policy, if I am not able to understand that, the employer, that means employer is making a policy, and if it is not understandable by the employees, there is no use for that. So it should be in a very clear way, and it should be understanding to the particular the members who are there in the organization. Policy may be a generalized one also, or it can be of a departmental way. So for example, in the case of an organization, it can be a general one also. For example, in my own department, I may have policies which is different to the particular areas itself. For example, if in a school, when I am having the policies, everything is that they should have the unit test to be done in each after completing these things. This is my policy, because after that you have to see that who are the girls who are weak. We have to call the girls. That means the tutor should have come and reported to me, this girl is not attaining, that means getting the pass mark and all. That means the policy, that means some little policy should be made so that that particular department can run in a very best way also. So it is not only that it is of a generalized one, it can also a specified one, or it can be for a useful for a group of members also.
But also when these policies are being made, they are written down. That means even though we say that if a student is failing in 2-term test, consecutively and is not able to perform properly, then the tutors also come and inform. So there is that we take extra tutorial classes, and also we give extra assignments. There may be written policies. Yes, these will be written policies. But also there may be unwritten ways also to help.
So that means unwritten ones are flexible ones.
But in case of hospital department, there may be written policies separate for the maternity ward. Excuse me. In the maternity ward, that means every mother who comes should be enrolled, and visitor who comes, baby should not be given in the hand of the stranger and things like that.
So these are the characteristics of personal policy. And now we can discuss with the different types of personal policies in nursing. The first one is the express policies. That means these are oral policies, or you can able these are flexible. That I had already discussed that when written policies are the one which is of, for example, in an organization, written policies are there. Madam has told in the maternity ward, written policies are there. In our hospital, we can say that previously we are not allowing the children to be allowing them to see the mothers. But now we have seen that we are in a flexible. We have changed that policy because the mothers, if for example the first child is there, if the child is only of 3 years old, the child may want to see the mother. The mother is admitted in the hospital for 2-3 days or 1 week. If the child is away from the mother, it affects the psychology of the child. So we have changed the policy that, and we allowed that the children can also come and see the mothers and they can stay with the mothers. That means there are some policies which is written, and I have told you some policies which are flexible. Here I give an example for a flexible one which is a change the policy. And another thing is the implied policies. That means it is opposite to the written policies. Here we can say that the behavior and the action of the supervisors are followed by others. If I am the supervisor, my subordinates will be following that particular policies. For example, if I am working in the school, if I have got the policies, and my subordinates also will be following that particular policies for maintaining the discipline, or we can say then only we can able to attain the goal. The main thing, the goal of the school of nursing is to maintain the good result. If we are not maintaining the policies of that one, or as madam has told, if a girl is failing for 2-3 times, we are calling her, and if the teacher is not giving special attention to that particular student, taking extra classes for that, we cannot able to bring the good result. Then it is of originated policies. These are, or can say, purposely originated from a top manager or to guide. It is originated from the top manager. As in the case of our institute, the director is the top manager. So he will make a committee. It is not only his own ideas, his own these things. Earlier also I told you, when we are making a policy, the committee is there. So they make the policies, and the final decision will be taken by the director.
These are also known as, these originated policies are also known as internal policies.
Internal policies.
I mean, this is not something which is to be governed by a larger body, by a small body. For example, all right, every 3 years we will try to see that some of you conduct a continuing education program. So that will be internal policy, which is originated by the administrator.
So that will help to maintain the goal of the hospital. Then imposed policies are under the direction of other forces. For example, as we are the School of Nursing, we are having the policies, but we are also following the policies which is applied by the Indian Nursing Council and also the Delhi Nursing Council. That means we have to attain the external policies also, because we are under that particular organization. So we have to, that is known as the imposed policy. That means under the direction of other forces, also known as external policies, and we have to follow that also to maintain the organization. And another thing is department policies. As I told you in the earlier also, each department can also make for example, maternity side. For example, in our medical ICU, we are not allowing the patients related to be in there with the bedside of the patients. Why? Because it may create problems, because the serious patients are there. We cannot able to make the other persons to come in. So it is an isolated, and we are maintaining a barrier nursing care there. So that is a policy which is made particularly for that department of medical ICU. For example, in the case of other, I told you maternity, we cannot able to make a policy that nobody should be there. We can allow the relatives also. For example, in the case of maternity side, we may allow some other persons also to look after. That means departmental policies also can be there. So these are the different types of policies which we can able to in a particular organization.
One
or
of
in
the
the case of a nursing profession itself.
Yeah, one of the other policies which often we forget also organization doesn't give importance is appealed policies. Over here the policy may be made based on the appeal which comes from the workers. And this again, it is just not accepted like that, but then it goes through a lot of committees and then it is approved. For example, posting of the people, duty hour changes. I remember, earlier the nurses had to do the duties from morning 6 o'clock to 3:30 and then from 3:30 to 10:30 at night and then from 10:30 to morning 6 o'clock. So those nurses who were coming for the evening duty, it was very unsafe for them to come at 9 o'clock or especially in winter days to the hospital, and there were a lot of problems which were there, and those nurses who had to go back, by the time they gave over, changed into their private, it used to be 11:30. So then the appeal came from the workers that we are ready to work for more hours in the in the daytime if the evening duty, or we start early, or night we can do it early and do the night hours long. That means we can do from 8 to 6 or 8 to 8 or 8 to 7.
In some of the hospitals are like that.
Yes.
The duty is night duty. Where I worked in PJ, the night duty is from 8 to 8 and morning duty is from 8 to 1:30 and by the time 2 o'clock we will be relieved from the one, and 2 to 8 is the evening duty.
So this is
a very convenient.
So this is called as appealed policies. These policies are made and then written down based on the appeal which comes from the worker on some genuine reasons. So that is one again very important, and which the personnel management needs to give importance to. Of course, for everything we cannot go and appeal that do not post the nurse in this ward and that ward, do not post her on night duty or evening duty, because often those kind of pressures also come. But otherwise, such kind of policies which affect to the larger population of that organization is considered and it becomes a written policy. Of course, it may be again institutional policy. It may not be a general policy for all the nursing personnel working. If a pilot is done by a particular hospital and if it is beneficial, maybe other takes that as a model and try to present it to their organization if their organization feels that this is feasible, and that may become the policy of the other hospital also. So these are some of the types of policies. These are the connotation given, but you know the policies are there, and those policies you should be aware of. That what are the policies which are set by the hospital, by the school of nursing, by the organization in which you are working, and sometimes things become very mechanical because you get so used to those policies. Now, let's see what is the importance, what is the significance of this personal policy. If you go into
the importance and significance of personal policies, these are the product of values. And each institute is having certain values. If you are maintaining that values, it helps establishing the standard of organization. That is very important. The standard of organization, for example, the certain policies are there in our nursing services. Our nursing superintendent is very strict and she is maintaining the policies, and that's why when we are giving a feedback to the patient relatives or patients, we are getting a very excellent feedback. Why it is so? Because we have given the values for our policies and we are maintaining it also, and because of that one, the organization is getting a very good name. And another thing is that to serve as a guide for quick and correct decision. I told you earlier, one staff is coming absent for a long time and he or she is not coming for duty for a long time, then it will be reported to the employer. Then the employer can take a decision according to the policy. It is written in the policy that if a particular person is absent for such and such, she can be or can be suspended from the service. So we can take the decision very early, and it is a legal policy. We can able to say the institute written policy is a legal one also. We can take the decision very early and in a very comfortable way without taking any stress and strain for that particular part.
Also, if we put it in a positive manner, suppose a nurse has been sick, say, for 1 year, and is hospitalized and there is no leave to her credit, still their policies may be there in between the lines. See, as we said that they are very strict statements, but still there is a flexibility, and that is what is very important, that maybe the person who is sick and has to still continue with the job, the seniority is maintained, plus she is advised to take the different kinds of leave. So policies actually, if you see, are made for the benefit of not only organization,
for the employees
but also for the employees. So employer, employees, both it is made. So policies can be to make quick decision for not help, for seeing that the person comes back from leave. Policies are also made to help the person in case of stress, in case of problems too.
In our hospital also we are having the policies. One of the employee was sick for a long time. We made a flexible possibility of this one. We made a committee for the medical check, and they tell that this particular person needs this much of leave.
Yes.
Then in such cases we are giving it like that. Our director or management is giving, and we have got a management committee meeting is also there. This matter will be putting there, and they will support the director and will say that, okay, this particular reason is there. In such cases we are considering also. That means we are having the flexibility also.
Yes.
As madam has told. And then another thing is that it gives to do a day-to-day activities. It is a guideline. As I told you, when you are coming to if the policies are there in the medical ICU, if it is written policies are how to take the over, what are the things to be done step by step. It gives a guideline for that, means a day-to-day activity, so that we can run the work in a planned way without having any problem and within the time which is permitted for us. For example, if I am not having a plan, I am not having guideline, when I am coming for the morning duty, I may not be able to finish the work. I may have to extend my time morning to 2 for 1 or 2 hours. Sometimes the warding charges will be, that means they will finish the work and then go. So it should not be like that. It should be so that it gives a guideline for us to do the work in proper way. And they provide a sense of direction to the organization also, and setting, that means priorities. I have told you in the beginning itself, we have to see the priorities and planning to be there. That means our plan should be according to the priority. For example, if we are giving a care for the patient also, every time I am still remembering that our medical surgical madam is telling, look into the patient and see the priority need and you do the work. That is very important. So when you are taking for a care of a patient also, we should see the priority for each work of the organization. Whatever may be the priority need is also very important. And it helps to work in a well-organized manner. It gives if written policies are there, it gives a guideline, and we can able to work in a well-organized manner. There won't be any confusion at all. They can be able to do this one, can be able to do like this. That confusion will not be there if the written policies are there. To facilitate a coordination of efforts among the members, it gives a coordination, that means cooperation with the members also. When the cooperation of the members is there, the output also is very good, and that is very important. They also help the managers and members to maintain a uniformity of action. That is also very important. If the written policies are there, for example, somebody was, madam has told that if a particular person we see that genuine reason is there, we may give extension of that is flexible. If a person who is not coming without any this one, and if in such cases we may not be giving that particular consideration to that particular employee. So we can able to say that it also has the managers and members to maintain a uniformity of action. That means if I am giving a punishment for example in my own students' cases, if they are not finishing their procedures in time, I may say that go back to the ward and do the duty. That means I am keeping a uniform punishment. It should not be like that the girl hasn't finished and I may allow, okay, you come for the class. Another girl came and she hasn't finished, I will say, no, you go to the ward. It should not be like, if I am making a decision and policy, it should be genuine and it should be of a uniformity is there. That is very important. And the effective delegation of the duties and authorities. It gives an effective delegation of work. It gives an effective delegation also. And they also permit cooperation as everyone is expected to perform. That means everyone, each Every individual of the organization is having the goal of the organization. So it gives also permit a cooperation as everyone is expected to perform the specified goal is there. So these are the importance, and I can say lastly the thing is that they also serve as a basis for further decisions and actions. It gives a base. For each thing we need a base also. So it gives a base. If I am having a policy, written policies or flexible, even I am taking a flexible policy for one particular person, it will be there, and I can take the same thing for the other same recent persons is coming also. So it gives a base for further decisions and actions also, and it also gives a control also, control action. If the policies are there, it gives a control. That means we cannot able to give for more freedom. Madam has told that you cannot able to give more freedom to one particular person. That means it should be in a control action. We should not be everything should be in a control. Then only we can able to run an organization in a better way, in a standard way. We can able to say that. On the world, they increase the moral in a person. It gives a moral improvement also. If the personal policies are there, I know that what are the moral things which I had to be maintained. It gives a moral impression about the particular organization also, and also about the employees also. If that, Madam has told that when somebody is doing in a better way, that means give an appreciation to that particular thing. It also gives, that means can say that the more as they increase the moral as well as the personal attitude towards that particular organization. So that is very important.
I think the essence of the whole importance or significance of personal policies is that the morale of the personnel is strengthened and increased, because as much as possible, if the written policies are there, the uniform decisions are made, justice is done, yes, and people know that this is what is done, so this is what I have done, and the resultant to this is this. So I think that's very important, because each person knows that if this is what my contribution is, the result will be this much, because it's what the written policies are like. Well, I think you've got two diagrams in a book, and you must be quite worried what is those diagrams about. But Eliama will explain us that is how do we formulate the policies. The diagrams may look difficult, but if you try to understand, they give a meaning. And remember, all the diagrams which are mentioned in the books are pictorial explanation of what is written in the word. So never get worried about the diagrams, but I'm sure Eliama will tell us how do we formulate the personnel policies.
Now, the method of formulating the personnel policies, we will see that policy selection and formulation. The policy emerges from the set of objectives of the organization. So we have to see that what are the objectives of the organization first, then from that we will start setting of policies. So the policies are developed from various policy options generated at the planning stage of management functions, and from this the personal policies are selected. Now on this diagram, if you will see on the top, there is national goals. The organizational goals are influenced by the national goal. So we were making a policy means we will see that whether the institution or the organization, where it stands, and what is the pattern of adopting the methods of making a policy for the personnel. That also we have to see that. So we are always looking, the organizational goals have been influenced by the national policies. And that means the organizational, from underneath we can see that there is organizational goals and objectives. Now from the organization, they are planning for a long-term objectives and a short-term objectives. And if short-term objectives, we have to see that there is, we will see the planning components. We have to start the planning. And the planning components of the management, if you will see, there are so many policies we will adopt. And from that there is policies, priority policies, options will be taken. And from the priority of policies, then we will think and decide which policy has to be selected, and then finally you will make a decision that this particular policy has to be selected, and this particular policy then we will implement it. We will put it into practice, and after putting it into practice we will control them, and then we will see that what is the result of that, and then we will evaluate. So the implementation includes the evaluation of the results and new policies are selected, or if it is a policy which we are implemented, if it is not up to right, then again we will see that, because the implementation and the result will be always been coordinated. So the policies which is been revision has to be done through this coordination. So first we will see that what are the priorities which we will be seeing for when you are planning for a policy, and out of that we will take the first decision, we will take which policy you are going to adopt, then you will implement it. After the implementation you will see that what is the result of that, what is the result out of that, whether it is suitable for the personnel, whether it can be again forwarded afterwards also, this also we will find it out, then you finally evaluate. So formulation of an, if it is not there, you will revise, which was the place which we are wrong, so we will revise it again, or otherwise we will make a new policy. Either you revise or you will make a new policy, so that the existing policy which we are following, that is not correct for the personnel those who are following. So in that case we have to see that the formulation of a new policy and revision of existing policies, these are been carried out through coordination. Then only we will be able to understand. So always we have to remember that the organization has got a goals and objectives. What is it? With that we have to, the management has to plan for the decision of the policy. If the policies are generated from different framework, and that will give us for a guide to action whether it is correct or not. So out of that we will take select a new policy which has been opted from that, we will make a decision, and then we will do the implementation, get the result, and then do the evaluation. Then we will see whether these objectives are maintained or not. If the objectives are maintained, in that case we will continue with that, or we will revise the policy. So implementation of the policy is done by a definite guided and controlled procedures and specified in the policies. Big policy has said that this procedure has to be done on this. So we have to see that the organizational goals and policies, what according to that we have to move it. So if you are evaluating, it can be done by keeping the records. So there is a policy, is always a written policy. So we can see that the evaluation can be done with the help of records and reports. So the procedure should explain that who has got the authority to implement the policy. We have to see that. That is very important, because these are the things will give us a guideline. Now who is going to implement this policy, and which are the methods we are using to monitor and controlling this, and what type of record should be maintained in connection with the action. That is what we have to see that. So here we will see about the policy's results and what is the decision going to be implemented. So about this statement we can see that there is a policy, but there is a clearly system of doing that step, that is called a procedure.
I think that makes it very clear now. Now you should not be threatened with the diagram, because it has simplified how the policies are formulated. Now once the policy is formulated, before we go to that, how would we differentiate policy from procedure, Eliamma?
Policy is a broad and general terms. It will guide to a decision making. You can make a decision for that. But procedure is a sequence of steps in which we are going to implement that policy. Sequence of steps which when we are doing a nursing procedures, we know that this procedure, we have made a policy that this procedure has to be learned by the student. But at the same time when you are demonstrating it, we are making it step by step. That is a procedure. That means step by step sequence we are teaching them.
Policy would also be that recruit the right kind of people. So that means there will be steps to follow. For example, advertisement,
then calling of application, selection of applications, scrutinizing the thing,
and
then we will call for the interview, and then we will be selecting the people, and then once they are selected we will give the appointment letter, then we will explain the job description.
Right.
There are so many things will be
so done. That will be procedure to the policy.
Right. So policy specifies an area of operation, whereas procedure shows the steps of reading that particular area. Then it is very easy to judge a policy. There is a difference, policy and a procedure. It is very easy to judge, whereas procedure that we can see that we have to see all the areas. Procedure in all aspects of the area we have to judge. So it is a very difficult task. Now policy is a guide to achieve an objective. It is a guide, whereas procedure is a way or a method to implement a policy. It's a method or a way to implement the policy. That is called a procedure.
So we said what is a policy, we also said what is a procedure, then
Yeah.
how do we differentiate it from rule?
A rule is a guide to action and a policy to guide thinking and decision making. Rule means you have to think that, you have to make a decision. Rule is also a guide to action.
And it is limited only to one particular situation. So that particular situation you have a rule and you
will make a decision on that.
It may not be a legal thing also.
No, it may not be a rule. It's a rules and regulations like we are implementing in the hostels. With the girls who are coming to the hostel, we say these are the hostel rules.
Yes. So this is related to a particular situation, particular problem, the rules are made, whereas policies are legal.
It is a legal and it has been written down statements.
Right. Even the rules are written down, but only thing rules may be only for a particular situation particular decision and all that, you know. Now let's talk some of the advantages of policy implementation.
The advantages of policy implementation, it can be for the management also, it can be for the employees also.
Right.
For the management, make the managing process very easy and specific one, and it helps to carry out the planned activities very smoothly, and it helps to maintain the consistency and uniformity for the management to maintain fair situation with the employees. It set a standard may be used by with other similar situation and objectives. Example like same which we can see that the selection rules and procedures can be done. If one hospital it is adopting the same selection procedure for a personnel, for nursing personnel, that means with that can be adopted by other hospital also. So there is a set standard. If there are other institutions they feel that this procedure can be taught on the same way or it can be adopted, they can also be adopted. The same way the procedure improves coordination among different units and conflict will be easily avoided. These all things the management will be helped when we are planning the advantages of a policy. If for the employees there is a systematically developed and implementation procedure give a kind of satisfaction to the workers. The workers will get a satisfaction because there is a policy, there is a systematically we can do the work from morning till evening. This is systematically ordered. So this is our hospital policy. When as soon as example for a patient who comes on admission to medical ward, when the patient comes immediately you have to see that which unit the patient belongs. There are different units, which units, according to that the days you will see that this unit the patient can be placed and which bed, which under doctor, and as an admission procedure that will go so. The same way it is systematically it has been done so the employee can get a self-satisfaction that I have done my work the best. It gives a team of sense of security, individual worth, pride and loyal to the institution. And it gives assurance into the employees that they will be treated with justice and impartiality. And this policy also will assure them their performance of their work. And that means that work, how much they are doing, that will be recognized. And same way also this will give the promotion according to the written policies. The person who is working for a long time and the work is been recognized, and according to written policy there will be a promotion also can be given to that particular personnel. And the morale also of the employee is boosted along with the policy.
Well, I think these are some of the important things because as both of them had been mentioning that the policies are made by the management for the people and also for achieving the organizational goals as well as individual employees' goals, for the welfare or for the growth of the organization and for the welfare of the staff and the employees. So I think this is in totality a very important task which any organization has to take up before even starting that particular organization, and of course it keeps on strengthening as you get feedback from employees or from outside agencies or from employers themselves. They understand, they sense some of the difficulties which employees are facing, so they start adding to those kind of welfare facilities. Well, we do talk about formulating a policy steps, but what are the factors which need to be considered to formulate a policy?
The factors which we have to consider for formulating the policy, that is, one is the objectives of the organization. Before we are formulating a policy, we have to see that what are the objectives the institution has always laid down. Because with that only we are able to formulate a policy. The facilities and limitation to be taken care of implementation of the policies. What are the facilities have been given and what are the limitation, which are the places which we have to limit, and the policy should not exceed, should not that.
Let's take an example. For example, every student nurse was supposed to conduct domiciliary delivery.
Yes, ma'am.
Yes.
Over a period of time, there were numbers. Earlier it was 10, then it became 5, then became 2. And now I think it is 0. Because the policy of the country, the health policy is to reduce the infant and maternal mortality rate. We should encourage institutionalized deliveries. So this is what we have to say, that if we want to implement a policy, and if the mothers do not want to deliver the babies at home, in the community, then the policy of the curriculum is that you should have these many domiciliary deliveries conducted. But it cannot be implemented because resources, facilities are not available. This is what Elima you were trying to say. Similarly, the continuous aseptic technique is to be maintained, or cross-infection should be checked, and also we should universal precautions to be maintained. But the gloves are not available in the wards. So how do we maintain that the universal precautions when the gloves are not available in the ward? So when we talk about the policies, it is also important the facilities should be given to implement the policies. I thought I'll add that what Eliama was saying. Yes.
Then the next factor we have to consider that the individual values, interests and abilities of those who are responsible for the achievement of these objectives. The individual values and interests and abilities. That is also one of the key factor which we have to consider while we plan for the formulating a policy. Then expectation of the people in the internal environment and also the external environment on the society. What people are expecting from this particular institution, they are going to expect from outside. The society, what they want exactly, the standard of nursing care when they will come to an organization, when you are expecting from the society. The personals that they are expecting that we will have to maintain all the facilities which has been given to them, their social activities, social facilities which has been for them, that also they will include from internal also, from external also.
And these are some of the challenges for nursing personnel. Could you kindly elaborate what are some of the challenges for nursing personnel, in managing and changing these personnel policies, especially in nursing?
That is, one is mainly regarding the changing strengths in the workforce. That is, we can see that more of the personals which is working in nursing, that is more of females. Then there is increased number of married females, and there is different levels of educational level in this personals, increase in the number of qualification. These are some of the changing trends in the workforce that we are seeing, that there is changing government policies also. That also we are seeing. So that is one of the changing trends in the main points of challenges in the nursing management. Then the second thing which we have to see is that there is
the changing values also.
There is changing values in the personals. The values are, there is increase to turnover, or it may be of migration.
Yes.
So there is, or there may be changes in the attitude of a person.
Yes.
That also is there. And some, if you will take an example, some hospitals, they don't issue the experience certificates for this employee for a period of time which they have mentioned in their job description. They are supposed to work for 1 year, and the person leaves the hospital in between for her own better benefits, and she is moving. And in that case, the institution will not give. So in that case, the person, she may be getting better benefits from other place, she may move to the other place. So they are making this type of examples or policies which will be there. So this is that cause change in the value of the personnel. Then changing expectation of the members. The members are expected that high expectation that the institution will give them the highest morale and all the facilities. But once it goes, they will be getting the lowest. So there is expectations are changed, which they may not be able to get it. And the next thing is that changing needs of the employee and employer. That is the advanced technology, expect the staff to get more of educated, and they have to be specialized in more specialized units. That is also the changing needs of the society as more. And nowadays all the technologies like which is being used in the ICUs and ventilators, care and things like that. So it will be they have to be the advanced technology and task has to be improved. Then changing government policies.
Yes, these are some of the important things which need to be kept in mind when we are talking of personnel policies, developing personnel policies for the nursing force. Well, with that, I would like to thank Eliama and also Madam Shantama for being with us in the studio, and I'm sure students have enjoyed listening you, and they must have really got over the phobia of personnel policies and personnel management, because this is one area which students are very scared of, but because your dealing was so simple, I'm sure they have understood it and they must have enjoyed. Now we close here, and the post-basic BSc Nursing teleconferencing will start at 2:30. We're sure to meet at 2:30. Back with you. Thank you so much.
Thank you. Thank you, ma'am.
Thank you. We had to tell you to go fast because the time was getting over.